outside of medical, right? So where we live, where we work, we play, and Healthy People 2030 categorize this for us. So it's helpful to have it categorized so we can think of ideas that affect health, but it really is so diverse. There's so many different circumstances, what you've seen in a lot of these different presentations over the past 2 days that can affect healthcare. So some of them may be income, employment, poverty, education access. We talked about health literacy, right? Healthcare access, so insurance coverage. Someone who doesn't have insurance, it's going to make a big difference. Provider availability, we talked about when we had the Native American speech today, too. Neighborhoods, so housing, transportation, how are we going to get to healthcare makes a difference. And then social support, discrimination, community engagement, that's all going to affect health. So a big part about social determinants of health that we really didn't talk too much about is bias. So real experience, all nurses, we have bias. One way or another, we have it. It is important that we don't belittle someone for having bias because it's innate, it's part of us. We need to support each other through any of the biases that we do have. So I love the quote on the bottom. Our biases are not something we choose. They are habits of mind learned over time. From experience, from burnout that we talked a lot about these past 2 days as well. These things we cannot always control, but we want to be mindful of. So I'm going to start with a little personal story that I have about social determinants of health. It is a little personal, so hopefully I don't get emotional through it, so help me through this together. So all of us probably have some sort of experience that we've had with social determinants of health. It's everywhere, maybe from a patient experience, maybe from a loved one or someone that you care for. So a lot of us end up getting some sort of passion for it through that experience. So substance abuse disorder is something that's deeply personal to me from the loss of my brother. All right, so for many years, addiction shaped his life. During that time, I worried. I distanced myself at times. I had hope for his recovery always. And I also was a nurse, caring for patients who had addiction as well. And being honest with myself, I really didn't truly understand what they were going through. My brother was incarcerated several times. Each cycle of release and relapse seemed to reinforce the barriers that he faced. He had limited access to stable housing, employment, and consistent health care. I remember a time him coming over for lunch, and he was limping. And what's going on? What happened? He was working for a tree business, and a tree had fallen on his foot. I said, "Why didn't you go seek help?" "Well, I don't have insurance. I can't pay for that." "Well, you have workman's comp. Use your workman's comp." "Well, I could lose my job if I use workman's comp too much. They're going to fire me. They don't want to pay for my health care." So all those concerns, right, that a lot of us don't think about there as well. He also, anytime he came to an event with our family, we always knew we had to make extra food. He would eat, and we'd have leftovers, and he would take those leftovers. And it makes me think a little bit in the hospital as well that sometimes, if you've heard with nurses, but that patient keeps asking for sandwiches, and some nurses say, "We need to limit this, we need to." But are we really looking at their needs? Is there some sort of deficit they have at home with nutrition and that we're not recognizing? We're just seeing frustration with them wanting the sandwiches. So all those things, I really didn't think about at that time either. I really didn't realize how significant those barriers were. And in my nursing practice, I carried some similar blind spots. I approached some patients maybe with frustration, questioning their motivation. Told myself they made their choice, right? They should quit. We have resources for them. They can make that choice. When we had young patients who passed away, It was always heartbreaking, but many of us would hear, oh, it was overdose, and we'd kind of shrug a little bit like it was acceptable, it was normal, and that's heartbreaking. I really prided myself in being respectful and providing respectful care to those clients, but I really didn't see the full picture and give them all the opportunities that I could have. It wasn't until I lost my brother that I was forced to really confront that complexity of addiction beyond individual choice. I began to deeply understand how substance use disorder is intertwined with the social determinants of health. It may not have been on that list before, but it's there. Factors like poverty, stigma, access to treatments, and involvement with the criminal justice system are all there. These aren't abstract concepts, they are daily realities. My brother's life showed me how the absence of that stable support and care creates that cycle that's difficult to break. After years of recovery, he relapsed alone. It led to his death, but it was preventable through support that wasn't provided. He was afraid of the stigma of asking for help. His autopsy also showed damage to his body. His heart, he was only 30 years old, looked like it was 90, they said. So all the damage that was happening and the lack of care he was experiencing. And my brother's story is not unique, right? It's an epidemic out there. It is very, very common. Many of us are touched by this. But recognizing my own bias, it was uncomfortable, but it was necessary to help me grow. So I hope you guys can see that in your future of care as well. Recently, I experienced a moment that kind of brought this full circle. A few weeks ago, I was at a local hospital in Connecticut. I was working as a resource nurse, and there was a new graduate nurse that was working, probably 6 months experience. She was feeling overwhelmed that day, and she had a client who had substance abuse that really wanted to just go home. So she had other patients with other issues going on, and just, it was over the top for her at that point in time. She was preparing to discharge this patient and didn't give him any verbal instructions, gave him the discharge paperwork, and he was about to leave without even shoes on his feet. A tech called me and said, "Hey, Nicole, I think you need to go check on this patient before he leaves." And I'm so glad that she did. I was able to give him some more resources and give him a pair of shoes to walk out in. And the nurse turned to me when I went up there, and she asked, "Am I wrong for not caring?" That question, it hit me a little bit. I had to think for a minute, right? Because the truth is, many healthcare providers have felt that way at some point. Not because they're bad nurses, did not make her a bad nurse, but because we're overwhelmed at times, maybe feel unsupported, and often we lack the full understanding of what our client may be going through. It's not just what they're pushing out to us in that moment. There's more in the background that we may not know about. But we cannot stay in this place. Our role as nurses is not to decide who deserves care based on perceived efforts or choices. Our role is to provide safe, compassionate, and equitable care, especially to those patients who are most vulnerable. Thank you. More. All right, so what I'm going to jump now into is why it matters in nursing healthcare. So hopefully that statement I just made helps us identify why it matters, because it's what we're seeing. But why it matters for nursing education as well is we need it for accreditation, and accreditation is very important as well. We have ASIN for our accreditor, and they require diversity, equality, and inclusion to be part of our curriculum, so we have to have it there. There's also the essential care competencies of professional nursing that tells us that we need to have in our curriculum bias, structural racism, and social determinants in there. And they want us to prepare nursing students to address those biases throughout their careers as well. We want to prepare them to continue this. As I addressed too, there is a need, and many of you addressed, there's a need to address the social determinants of health. So it is part of our curriculum because there is a need. There's also a lot of studies, like one from 2017 in the United States. In our emergency rooms, 60% of patients who came in had a preventable chronic illness. So that is a lot. So we want to engage our students so they can prevent this from happening, right? So if we engage them, they're the future. We need to get them engaged now so they can make a difference in the future. As much as we want to do everything, there's always limitations, right? Things that make things more difficult for us. So one of the major ones is it can be intimidating for someone to stand up and talk about some of these major issues like racism, bias, and social justice. So a lot of faculty may have difficulty with that. We also may have limited locations for clinical. I don't know about some of your schools, but our students really have 2 major clinical sites. So they're going to see that community and not really a diversity in different areas. Instructors also can't always control what we see. Like the great experience, I think it was Misty that shared with social determinants of health and clinical, those case studies, amazing, but we don't get to see that every clinical shift. It's not in our control. There's also a potential lack of education. So we have adjunct clinical educators. So we're saying there's a deficit in nurses understanding this. How do we know our adjuncts know this? How do we know our preceptors are teaching our students this as well? And then so many things. Everyone is affected by something of social determinants of health. We can't limit it just by the list from the Healthy People 2030. It's so diverse that it's really hard to just outline its X, Y, and Z. So that makes it an extra challenge as well. I teach nursing students in clinical. I know a lot of you do, but they get more excited sometimes with the injections. I gotta put a Foley in. So it really takes a lot of effort and excitement to really bring in, well, look at this. This is why this is important. So that can be an additional challenge to get that buy-in. Other things is it's in the curriculum, right? We're teaching it once. We're teaching it one time, and that's not the way it should be. It should be intertwined throughout the program. We want to make sure that it's reinforced because that's when we will learn best. We don't learn best one and done. A lot of our faculty recognize there's a need to teach and really struggle with how to do so. So that's another limitation as well. So when we're teaching, the big domain that we have to address is the affective domain, right? The emotions, the heart, which is going to connect with our students, especially on day one. Why do nursing students go to nursing? Because we want to help others. That's usually our initial gut feeling is why we choose nursing. We want to help people. So we really need to connect with that and get beyond passing the test, right? In the classroom, is that going to be on the test? Is this going to be on the test? This is part of life. This is your career. This is developing you. So getting to that concept can be a little bit difficult. Where cognitive and our psychomotor teaching, right? They're getting tests, they're getting validations. We teach that so promptly, but getting to that affective domain with motivations and being able to address that with mindful practice can be a little difficult. So we have to promote that environment where we have discussions, where we have a safe environment for students to communicate with us and learn about social determinants. And so other things that are available, the ODIN, there is a toolkit. So I think as part of 2020, we've had a lot of growth with things and resource, which is great. So ODIN does have resources, and part of these resources include curriculum evaluation. Are we meeting the standards in our curriculum? That's important to review. And they also have resources on health equality, including case studies and other clinical resources as well. Simulation also has grown like crazy since 2020. Great, because we can manipulate situations to happen that we can't control in clinical. There's also a lot of virtual clinical situations as well. We use ATI, I don't know if you guys heard of ATI, but V-Clinical. They have a community health program piece in it that ties in social determinants and has great experiences and learning points for students as well. Other things that we can do, we want to make sure that they're learning about implicit bias, so giving those resources for them to test their own bias as well. Parent narrative analysis, so our maternity presentation earlier, that was great. So hearing from those patients directly, those are great tools. Community immersion experiences, going places, seeing things in the community, those are helpful as well. And then exercises, talking about ethical dilemmas, working your way through, having discussions is always helpful. In the classroom, say this is an example of a case study, but it starts before it's in the curriculum of we're talking about social determinants of health. In one of our courses, communication is done in the first few weeks, and we bring up our health literacy. Our patient here doesn't have insurance. They get admitted to the hospital, and we have great conversations and can connect and bring out that passion of caring and recognizing needs for different clients. Simulation, great experiences as well. We tie in from the beginning. We have a communication simulation that we have a transgender patient and discussing that and having conversations. Even as we move on to some of our really near simulations we have in our maternity simulation, our clients speak Spanish speaking only. So those are great things that you can tie in as well. Additional things to think about in clinical. So clinical hands-on, we learn really well, so how can we promote it? Trying to choose diverse patients is really important. Even from choosing diverse patients, I'm gonna say, I've had some students that speak Spanish, and they feel so much more comfortable with those Spanish-speaking patients. I'll have them with one patient, and they're shy and timid, and I put them with the Spanish-speaking patient, and they're glowing in their glory. So I'll use that sometimes to build the confidence, and then I'll have the students switch, right, where someone who doesn't speak Spanish is going to get more comfortable with a Spanish-speaking patient, and then their peer is going to get more comfortable and grow speaking to the non-Spanish-speaking patients. Post-conferences are key. We need to reflect, we need to discuss, we need to learn from others because not everyone's going to have the same experiences. Reflections, care plans. Care plans, the most important part that we don't see is individualized. When they're taking something from a book and it's black and white, it's not going to have those social determinants of health. We need to make sure that it's individualized for those clients. Very important. Expanding clinical experiences as much as you can. You can be limited by the area that you're at, but what can you do? We've used senior centers, which is wonderful for health promotion and seeing what resources they have for the community, for your at-risk senior clients. What do they have? They have extra blood pressure monitoring, they have activities, they have transportation, right? What resources do they need? What are they covering? Community centers are also helpful. We've done that before as well, where they can see clients maybe that are not insured and see that aspect of how they can get care and what we're concerned about. Right, social determinants of health are essential to help guide us for health promotion as well. Students may not see that it being essential right away, so it's our job to help teach them that. Over 80% of poor health outcomes are related to things like social determinants of health, so that's why it's so important. Some of us also may stereotype, this is what it is for social determinant of health, but as I said, it's very broad. Anyone can have a social determinant of health, from your 75-year-old sweet lady maybe her husband just passed away and she's living alone. Do they have different access for nutrition, right? So many different things that we can think of. And then we need to make sure that students are doing patient-specific. It's really, they're thinking about the patient as a whole, not just the diagnosis. That's the big thing. How do we evaluate what we do, right? So we're trying our best, we're having interventions. How do we know we're doing well? So there are available with the ODIN, there is a survey that you can give students to see how they had their experience with diversity, equality, and inclusion. We also, SLOs, everyone has SLOs, having that included so we can have our student learning outcomes to make sure that they're addressed within the semester. And then long term, how do we really know what we're doing is affecting the healthcare situation? So are health disparity metrics being measured, and are they decreasing? Are we seeing improvement? Future of nursing. So we want to make sure that we promote this as much as we can, and one way we can do it is making sure that we're educated, our adjuncts are educated as well. So we want to make sure that education is provided. There are resources that have shown that once we're educated, there's improvement. So easy enough for us to be able to provide. Other things as well is using social determinants of health in our assessment documentation, which may be lacking. I know ours primarily really consists of head to toe, right? Are we really looking at our social piece as well? Expectations for making the care plans more personal, discussions, as we said, and reflections. Future also is technology. We've seen a lot of future of technology with AI. That was great as well. So future of technology. So two important things that we see in social determinants of health are access. How do we find that information? And is that information accurate? Dr. Google? No. Right? So we are seeing a lot of students, digital platforms, right? Very, very popular. I got to get up and coming on this myself. I'm a little behind, but up and coming for many of our students. There was a study done in 2025 that found that social media can really help with social determinants of health. We can really connect and we can give accurate information, and people will access it as well. So I think it's a great option for nursing students. For example, we have a student nurse association at our school, which I feel like most schools have. And with that student nurse association, we have a social media page. What a great connection we can do with our own community, which is our college. We're a community college, so we do have a lot of health issues. We have nutrition issues. There might be limitations to healthcare and insurance as well. So those are the aspects the students can start and make a difference before they even graduate. So it's a great tool to think about. EHR, we got to dive into that because that's also being used so much with helping to identify social determinants of health. So teaching our students, how do we look at a chart and kind of get those red flags to ask more questions? All right, so in conclusion, we really need to make sure that we're integrating our social determinants of health in our nursing education from the beginning through the end. We play a really critical role in fostering self-awareness and cultural humility and recognition of implicit bias to our students. So sometimes we have to tell them, like my story, that we've had it and it's okay. And how do we grow from this? It's okay, we recognize, we grow. Hopefully we take some teaching strategies and can learn some teaching strategies for helping our students understand this and build clinical judgment with social determinants of health. And if we do this and we embed this, we can make a difference in health long term. Nursing students are our future. We're our future, so we have to help make everyone grow. Thank you. Questions? Yes.
Yes. Have you ever participated in a poverty simulation?
I have not. No.
So this is a 3-hour where students come together, not just nursing students, but social work students and occupational health, maybe even clergy, and we perform a kind of a collaborative community where students are assigned roles. And it could be a single mother with an infant and the boyfriend is 19 and he's just got out of prison. So that would be one family unit. Another family would be a mother, father, grandfather, and a 17-year-old daughter. Another unit, maybe 3 kids and a single father. So there's different clusters or groups, and each week is represented by an 8-minute segment, and then a foghorn goes off. You're given an envelope that says how much money you make per week, how much you have to pay out in utilities, your mortgage payment, expenses for travel. Now, travel, getting to and from your places is key. So you're given these transportation tickets, and you have only so many to get to work and back. The mom may have one to get to social services and back, Catholic Charities and back, to the grocery store and back, and it becomes very stressful. And then if you have children going to school, they have to go to school, and they participate in like an 8-minute activity. The foghorn goes off. Now, you could be at work, you got your paycheck, you're rushing to get to cash your check quick place, and as soon as it gets to your turn, the window closes. And so now you have a transportation ticket that just gets you home. You have to worry about how you're going to get to work the next day. How are you going to pay that mortgage? I am telling you, this is the most exhausting and stressful for me. I had anxiety. And the students become immersed in these different roles. And you may have a student that goes to school and they're talking about, what do you want to be when you grow up? And Lama will say, I'm going to go to school and become a doctor. I'm going to do this. I want to become a nurse. And then halfway through the process, where are you at now? Well, I was an athlete. I was hoping on getting a scholarship, but my family couldn't pay the mortgage, so I had to get a part-time job. And so I got my part-time job, and all my money goes towards paying groceries so we can put food on the table. And another one goes, well, I just got out of juvie because I quit my part-time job because I made money selling drugs. And I had to help support the family, pay this bill and that bill. So you had these kids with these big goals, and all of a sudden they plummeted halfway through. The dinner conversations, hey, Johnny, what'd you do in school today? That doesn't happen. How much money did you bring home today? What can we do? We got this bill to pay, we got this bill to pay. Oh my God, I have to go to social services. I just got a notice saying that I have to go back to work, and we're gonna get our SNAP benefits cut. So I mean, it was just constant anxiety and hustle and figuring out who can pay this, and how much was your paycheck, Johnny? We need to pay the mortgage, so very immersive experience. The students got a lot out of it. We have a lot of sheltered students that come in and have no clue what the real world is like. I happen to have 5 kids in a short period of time, so I kind of went through that rob Peter, pay Paul thing, so I knew how to manipulate some of the things that were going on, but I had a student for my husband. He was the deadbeat boyfriend, that just got out of jail. And he kept asking me money for lunch. I'm like, eat leftovers. You don't need lunch. Just come home. I'll have dinner waiting. We need money. Go get your check cashed, They give you cards to go to the pawn shop to cash in your, heritage family heirloom ring. And the guy behind the counter is taking his time, writing it out, erases it. He goes, how much do you want? And they tell you what your limit is. And I says, $100. I'll give you 30. So and there's this long line forming. And then you go for your job, your job table to get a job. And they're having a conversation between the two employees are having a conversation together, laughing and giggling, and you're trying to get their attention. Hey, I have 8 minutes, come on. 8 minutes to get a job, cash a check, get to social services. But that is the reality what our people are going through. Those are the social determinants of health. And where does healthcare fit in? Who has money or time or transportation to get their healthcare needs addressed? Yeah. So I didn't mean to take over, but I feel your passion for community. It's mine too, and obviously you can tell. But
yes, thank you. Thank you.